Hello, everyone. Welcome to the first video lecture of Chapter 8 for HIM 120. In this video lecture, we'll discuss how healthcare facilities organize and retrieve information using indexes, reg registrars, and registries. Excuse me. An index helps guide reference while a register formally records items and actions. The Master Patient Index links a patient's medical record number with other identifying information. So we can match one patient's information with one patient. Automated MPIs use computerized databases for this quick retrieval and integration with other systems. We still have manual MPIs. These rely on Rolodex, index cards, and other more, shall we say, less advanced methods of matching patients with their information. We'll talk about the pros and cons of both systems and look at such things as magnetic strip cards and other information in this video lecture. Okay. And again, this is Chapter 8 covering indexes, registers, and health data collection. Indexes, registers, and registries allow the health information to be maintained and retrieved by facilities for the purpose of education, planning, research, and other non-clinical needs. According to the American Heritage Dictionary, an index serves to guide, point out, or otherwise facilitate reference. The same source, meaning the dictionary, defines register as a formal or official recording of items, names, and actions, like a church registering births, baptisms, burials, and so on. Healthcare facilities maintain registers to record admissions, discharges, births, deaths, and other events. A registry is an organized system of collection, storage, retrieval, analysis, and dissemination of information on individuals who have a particular disease condition that predisposes them to the occurrence of a health-related event. So we have cancer registries, death registries, autopsy registries, and they all basically do the same thing. It's an organized system for the collection, retrieval, analysis, and dissemination on individuals who have a disease, a condition, or a certain event, such as death or an autopsy. The Master Patient Index is the index that links a patient's medical record number or unique identifier with a common identification element, such as a complete name, date of birth, gender, mother's maiden name, or social. When we use the term automated MPI, we're talking about a database that basically identifies a patient using information sets, and then they match it with patients who receive services from a facility. An admission discharge transfer, commonly referred to as ADT system, is used to input patient registration information. This results in the creation of an automated MPI database that allows for the storage and retrieval of the information involving any patient that was admitted, discharged, or transferred from the facility. A manual master patient index requires the typing or manual posting of patient identification information on pre-printed index cards, and limited information can be received. It's essentially a flat file. It's housed in a vertical file with one card for each patient. I've seen these on Rolodexes, microfiche, microfilm, and other things. Basically, they all serve the same purpose. There are advantages and disadvantages to both. Let's cover the manual MPI first. It's cheap to maintain. You basically buy equipment, the index cards, you get a Rolodex, maybe a typewriter, and you're off to the races, right? Maybe you want to go with word processing, so you need a computer or what have you. But compared to an automated MPI, this is a much less expensive option. The manual MPI limits the information that can be entered on each card. And again, an automated MPI, since it's another relational database, you can keep adding tables to it to meet the facility's growing expectations for data and data retrieval. The manual MPI requires retrieval of information within the Health Information Manual Department, Information Management Department. So again, that's both a good thing or a bad thing. It's more secure, but if you have somebody who needs information from the MPI and they're outside of the HIM department, they're going to be locked out. Now we're going to move to the other side. The automated MPI allows for retrieval of patient information according to phonetic filing, such as Soundex, right? And in some ways, this has an advantage. If you type things, mistype somebody's name, have a typo, whatnot, on a manual MPI card, you're going to have a problem. Automated MPIs allow for rapid retrieval of patient information, right? So it's much quicker than having somebody scan through a bunch of microfilm, microfiche, or a Rolodex. Finally, automated MPI can capture patient information upon admission, and with the computer interface, you can have people view it in billing, admitting, anywhere you want. So what does the master patient index do? It basically matches each unique patient with their information. You can think of it as a customer database or a healthcare organization, right? And again, one of the things we want to do, just like when we had people sign up for the Canvas class, we want to avoid the creation of duplicate records, right? We want to have just one set of records. Otherwise, in the same way that I can't accurately assign grades, we can't take care of patients if they have three different sets of records. We can't really provide continuity of care. Excuse me. A magnetic strip card is like a plastic credit card that contains an electromagnetic surface that's capable of holding a small amount of information. This is different than a smart card. An MPI card is basically the source document for the master patient index. This is different than a magnetic strip card as it can be updated and serves an entirely different purpose. Last slide before we go on, I want to talk about the disease index, procedure index, and physician index. If you can kind of think of it this way as a disease index, we're going to have all the different diseases that we have in the hospital or the healthcare facility, and it's going to be organized according to each unique ICD-10-CM code. So all patients with hypertension will be classified under I-10, right? The procedure index is similar, except we're going to be organizing things by ICD-10 PCS codes or CPT HCPCS codes. So that's how we'll be organizing these records. The physician index is organized according to the physician ID number. So you'll hear this a lot of times in primary care. They want to pull somebody's panel. So that's the listing of each medical record number and records for a patient that has a particular physician as their primary care provider. And that's all I have for you. Please reach out if you have any questions about this material. Our next video lecture will cover registries, data collection, and abstracting. Bye now.